Hey everyone, let's talk about running back for the Detroit Lions, David Montgomery, and the rib cartilage injury that he sustained on Sunday. So on Sunday, he was running with the ball, and during a tackle, as this picture kind of shows, he ended up landing on the ball as he made contact with the ground. And we believe that it hit the upper part of his chest. And when the sports medicine staff took him back underneath the stadium, they initially did an x-ray and it was negative for a rib fracture. However, later on, he was then diagnosed with a rib cartilage injury. So I'd like to talk a little bit about, what makes a rib cartilage injury a little bit different than, say, just a bruised or a fractured rib. So let's talk a little bit about the anatomy of your ribs and your rib cage. So first of all, the purpose of your rib cage is to protect your internal organs, primarily your lungs. So that's really, at the end of the day, that's what we're really looking to do. When we look at each individual rib, each rib actually starts with your thoracic spine in your upper back. And so your rib will originate there, wrap around to give you a nice bony armor for the lungs themselves before attaching to your sternum or your breastbone in the center through a piece of cartilage. And there is a little bit of a nuance in terms of how your upper ribs move versus your lower ribs. What we're looking at, though, is more so the cartilage attachment from where the rib bone ends and its attachment to the sternum via that cartilage. And that is apparently what David Montgomery injured. So again, the x-rays were initially read as negative during the game with the x-ray machine that they have underneath the stadium. However, that's likely just means that there was no actual rib fracture. And like I was saying before, we're looking at that junction that is circled in red between where the rib ends and the cartilage begins. And we're not exactly sure which particular level. So there's 12 ribs and they're numbered 1 through 12 accordingly. And we're not exactly sure which rib or how many ribs and the cartilage associated with it is involved in David Montgomery's injury. But we do have some idea in terms of the timeline, given the fact that it's not so much of a bruised rib, but more of a cartilage injury. That's going to take a little bit longer time to heal because the cartilage doesn't have as good blood supply. And as we've seen with some of the other injuries that we've talked about, the better a blood supply that an area has, the increased capacity that area has to heal, and the faster the athlete can return to the field of play. However, cartilage, especially the cartilage that attaches the rib to the sternum, doesn't have really great blood supply. So we may be looking at a little bit longer timeline in terms of David Montgomery's return to the field. Now, when we talk about an athlete coming back from a rib cartilage injury, we're not just looking at the healing capacity of the actual cartilage injury itself, but we also need to take into consideration some of the musculature that attaches to this area. So we can see a few different muscles that are highlighted in different colors. If there is more of an upper rib injury, so we're thinking ribs 2, 3, 4, 5, one of the predominant muscles that attaches there is your pec minor muscle. So that's going to be involved with rounding your shoulder, a lot of accessory muscles of respiration to help you breathe. And then when we take a look at the intercostal muscles, which are highlighted in green and yellow, those span between each individual rib. And again, those muscles, they help to allow the rib cage to expand as you breathe. And they're what we term primary muscles of respiration. And then we also have your serratus anterior muscle that attaches a little bit along the lower part of your rib cage. And that has some implications in terms of how your shoulder and your shoulder blade move. So we're not just dealing with just the cartilage injury itself of the rib cage with David Montgomery, but also how some of the musculature around the area are going to be interacting as he goes to run, pivot, cut, breathe, even potentially catch the ball as he extends his arm into a receiver type position. The other major muscle group that we need to consider when we talk about the rib cage are your internal and external obliques. So especially for a running back position, that's going to be really important with rotating your torso as well as with change of direction and just bracing your abdominals for impact when you get tackled, make contact with the ground, etc. Now, when we talk about this particular injury, again, we've talked a little bit about, the muscles that are attaching to the rib cage. We've talked about the cartilage itself, but really the biggest thing with this injury is that it is very painful. So it's painful to breathe. It's painful to make a Valsalva maneuver. So to bear down, whether you're going to the bathroom, whether you're just getting up and down, if you laugh, cough, sneeze, things like that, those are things that are very, very painful. one of the ways that some of the sports medicine staff will attempt to deal with this type of injury as the athlete's looking to get closer back into gameplay is that they will actually do a pain injection to this area to numb the pain once enough healing has occurred. There is some obvious consideration when we think about injecting this area with medication in the fact that the needle is going to be very close to the lung field. So it's going to be very paramount that if they do decide to inject this area, that they need to make sure that they don't puncture the lung. Obviously, that's a very bad thing to do, and that pneumothorax can hold him out even further. So we'll see how the sports medicine staff manages David with this injury.